Okay, getting in and out of the shower. Now, in my opinion, and I think a lot of people would agree with me, the shower is the most dangerous room in the house. Now, I'm going to show you how I get in and out of the shower daily. Once again, as I always say, this may not be the idea for you, but it's what I do. Maybe you can get some ideas from it. First thing what I do is I make sure I have an extra liner with me. And I just come in and I get on my shower chair. When you're traveling, you may not have access to a shower chair. Hotels generally are pretty good about providing with one. You just have to ask for it. I've been at friends' houses where I've used buckets to sit on, turned upside down. I've used plastic chairs that they, had out on their patio or whatever. I've even sat in the bottom of tubs, which I wouldn't recommend them if some of your friends are like mine and still clean their tub like they're in college. But nonetheless, those are a few different ideas you can use. I don't recommend really standing in the bottom of the tub with one leg for, I mean, you can do it, I've done it, it's dangerous though. If you fall, and the chances of you falling are pretty great, you may have some of that sticky stuff on the bottom of the tub that helps keep your grip and all that stuff. Every situation is different. This is just some ideas for you. But what I do, which makes it totally, as safe as possible for me, is I come up, get on my chair before I get in. I'll take my leg off, take the liner off, and then get in the tub, shower, use the chair for support when I'm washing my backside, that sort of thing. And then when I get out, I've already got staged another liner to put on, and I'm ready to go. Pop it right on and go to shave or whatever's next, to get going. And sometimes I'll even wash this liner while I'm here in the tub. As you can see, I got my other thing of antibacterial soap. That way I can wash it, set it aside, and then pat it dry and take it into the stand and dry it as I go, kind of multitask a little bit. Another thing about cleaning your leg, now I use this antibacterial soap, and I think I've already talked about how I'm not a real big fan sometimes of antibacterial products. But I do use it on my leg to help with rashes and that sort of thing. I use one of these scrubbies to wash with. You can use a rag or something. I recommend that for your leg, not for your liners, but for your leg, you do use a washcloth or something like that. And get a little more aggressive with it and really clean it off. Doing it by hand, I just don't feel is good enough. You want to kind of, because you'll tend to get some dead skin and stuff like that, depending on how your suture lines and that sort of thing are, and it just helps get rid of that excess skin, rejuvenate some cells and that sort of thing. A couple other questions people ask me. I've had people ask about shaving the leg, what's left of your leg, and as you can see, I'm a pretty hairy person. I don't recommend it. I've talked to several people about it, and they say the chances of having an infected hair or something like that are just it's not worth it. You'd think that maybe that might be an ideal situation, but it really doesn't seem to work that well. Alright, so getting up at night to get a drink, go to the bathroom or whatever, can be a bit of an issue for amputees. One thing I will say is my friends that I know that are above the knee amputees, what they generally do, that stuff, because I've asked them, is most of them use crutches or a walker. Just because when you're above the knee amputee, putting your leg on is a lot more involved than it would be if you're below the knee, generally. But what I do is I, of course, take off my leg to sleep, and I take my liner and I put it inside the leg. That way I know where it's at. Sock, sometimes I'll put it on, sometimes I won't. And this is going to depend on how well your leg fits. If you need a lot of socks to wear it, you probably want to put at least a couple of them on because it would be too unmanageable and might be too dangerous. But I usually won't use one. It'll fit a little loose, but just to get around the house real quick, it's not that big of an issue. And I take my leg and I put it up close to the head of the bed. That way when it's dark, I know where it's at, and I can find it. I've been known to place it here or at the foot of the bed also. The one thing I will warn you or tell you to do that you need to do is try to keep it out of too far from the edge of the bed in case you know, your other half or spouse, whatever. Someone could trip over it. That's basically what I'm saying. So I want to get up at night. I'm laying down. I find my leg in the dark. You can do all this by feel. You don't have to worry about a light. That way you won't wake anybody else up. I mean, if you have a light by the edge of your bed or whatever, you know, that may work as well. But I just put mine on in the dark. I can tell when it's going on. And the great thing about this particular system, which is called the pin system, is I can hear it. I can hear the clicking noise when I get up, so I know that it's on. Whether it's on, you know, more than likely properly, as long as I can tell, because I know which side the lock's on. If I could reach down and tell which way the foot's facing and all that. I don't want to put it on backwards or anything like that, which would be hard to do, but I guess possible. And I can get up and take care of business. Okay, and that's it for this video. Hopefully there's some information that somebody out there can use. Next video will be a little more exciting. We'll get back to doing some sports type stuff. Thanks again. Take care.